Hello everyone, and welcome to the third presentation in our series of 3 webinars on governing in an era of accountability, presented by Jim Rice of Integrated Healthcare Strategies and Kurt Waltenbaugh of Carrot Health. My name is Kelly Perkle. I'm a consultant with Integrated, and today I'll be facilitating this presentation. A couple of housekeeping items. A reminder that all lines will be muted upon entry, and please use the question and answer box on the right side of your screen to submit questions throughout the presentation, but we will hold and answer the questions at the end of the presentation. In today's third and final presentation in our series, we'll be focusing on transforming the consumer experience and creating a culture accountable to the customer. The previous 2 webinars in our series were recorded and are available on our website or via email request. Each webinar opens with 5 key messages and closes with 3 actions that boards should consider. I'd like to now introduce our presenters. Dr. Jim Rice is the Managing Director for Governance and Leadership at Integrated Healthcare Strategies, a division of Gallagher Benefit Services, located in our Minneapolis offices. Jim works with hospitals and health systems of all sizes to enhance the effectiveness of their boards and physician leaders, and has over 35 years of experience in over 34 countries. Kurt Waltenbaugh is the founder and CEO of Carrot Health. Kurt has spent his career building and launching companies to better understand and influence consumer behavior, primarily at Optum, a division of United Health. Thank you both for being here today. Jim will be covering the first portion of our content. Please, everyone, welcome Dr. Jim Rice.
Thank you, Kelly, and good day to the participants on this webinar. As you can see on slide 4, we hope our conversation today will weave around 5 key messages. First, a greater recognition among the senior leaders and board members of health systems and hospitals of all sizes that the focus on customer is important, and we're intentionally using customer rather than patient, as you will see in this presentation, to shape and encourage our new approach to embedding new behaviors in our own systems as we try to build strong relationships with those customers. In that process, we'll be looking at a second key message, which is the customer experience needs to be customized around individual customers as well as groups. We'll be using data in creative ways to guide the mapping of these experiences and to modify the behaviors of our own employees and physician colleagues to make sure those experiences go smoothly. We'll be looking at how information can be harnessed to monitor our culture and to continuously improve it, as well as looking at new ways to report and celebrate results as we move through this. We've framed this third webinar to look at the customer, and so it's important to ask the question, who are our customers and stakeholders? What do we need to do to earn their loyalty and their enthusiasm as we make our journeys into population health and to accountable care? We've identified on the left side of slide 6, 10 types of customers or stakeholders. Certainly patients and patient families are at the top of the list, but we can't ignore physicians, employees, all the way through even to community leaders and media. We will be focusing on customers that are the key users of our services, patients and patient families in this webinar, but the same principles and practices can help inform how we identify and nurture relationships with all of these groups. Let's look at the maturation process on slide 7, where we move from the patient into their context of the community, some of the risk factors that they encounter as they journey to better health as well as health care. We want to have them be an end user of our resources, but also we have to understand that the maturation can be an opportunity for them to be a patron and support back services and resources we need their purchasers, their consumers. In all of this maturation process, we should keep in mind the 3 R's of building relationship, earning a sense of rapport with these customers, and certainly maturing to the point where they respect us and want to engage with us long term. As we look at our customers and find new ways to harness information and data to target how we interact with them and improve the cultures for higher accountability of care, we find it useful to keep in mind the triple aim that has been championed by the Institute for Healthcare Improvement for the last several years. The focus on improving the patient experience with both a focus on dimensions of quality as well as satisfaction, improving the health of groups of customers, not just individuals, and certainly to look at the cost effectiveness of the expenditure of resources to achieve better health and better health care. As we look at the challenge of identifying our customers and their needs and alternative ways for us to interact with them and to build the experience in the most positive way possible, we've found it helpful to be informed by some of the work in Harvard, where they look at the experience in health through the lens of customer experiences in a wide variety of industries and sectors. And an important element of this embrace of the new approach to the customer, the patient, and their relationship with us is the desire that we're finding for them to be fully engaged, to be empowered, to recognize that their health is important to them long term, but they have a responsibility. And so while we will be discussing in this webinar the accountability necessary for healthcare organizations and health systems, we acknowledge the need for individuals to be accountable as well in that partnership for their health and well-being. Some of the work by Harvard is also a interface with the use of new data that helps us understand not just the demographic profiles of our customers and not just the scope and nature of how they use our services historically, but to embrace new forms of information about their psychographic profile, how they use and interact with other services, how they look at the social determinants of health, as we have discussed in our first 2 webinars, but we want to take it to a new level now. As much as many of us in the health field think that everybody eats and sleeps and worries only about health, it in many respects is a grudge purchase. They are not looking forward to the opportunity to sit for an interminable amount of time in a waiting room of a clinic or a hospital. And so we have to take a fresh lens at how we look at their customer experience. And increasingly, as we deal with chronic disease, we map those experiences over significantly longer periods of time. And so as we see on slide 11, the mindset that we would encourage all of us to keep in mind as we look at what are the customer experiences, what are the key dimensions that we should embrace, it's a useful frame to think of the 5 E's of a customer-centered experience. Will the experience actually lead to a cure, not just dealing with some of the symptoms? Is there empathy in that experience that makes them feel like the providers really care about their health status and their well-being as an individual and as they're a member of a family unit or partners? The third is efficiency. Their time is important as well as their money, and we see the fair value of that in the blend of items 3 and 4. And because the trends in health insurance and health economics in the United States continues to drive so much of this by out-of-pocket expenditures, they are increasingly looking at the experience with us from a retail lens. We cannot assume that they are going to always enjoy what we are doing with and for them and to them, unfortunately. And so empowerment becomes another key dimension of this, giving them a greater sense of choice around treatment plans and around health status. And so we would ask all of us to keep in mind this mental framework as we start to identify experience maps. On the bottom of slide 11, we acknowledge that there are unique patients that will have quite different experiences depending on their health requirements. An 80-year-old Hungarian woman with diabetes and several comorbidities will want and need and expect a different experience than a 50-year-old single African-American male with heart disease, or a young Caucasian couple in their mid-20s having their first routine birth experience. A 30-year-old Hispanic mother of 3 scheduled for a facelift will have a completely different attitude toward the experience than a 65-year-old Norwegian ancestry farmer with basal cell cancer. We want, therefore, to keep in mind as we mature our understanding and appreciation for using information to understand who our clients are, our customers, how they want to interact with us. It's very useful, and we're finding across the United States, health systems are starting to actually develop graphic depiction of the working relationship in a patient experience map. On slide 12, you'll see a link when you download our slides that will take you out to a series of these patient experience maps. This particular one is difficult to read, but you'll see that the patient moves from left to right. They're very anxious with the pre-diagnosis. They go into a diagnosis phase and then into treatment and maintenance. The patient experience will vary by each of these categories of patients. The main thing we're trying to communicate with our audience in this webinar on slide 12, and also as we move to the experience we'll show you in a moment on 13, is that we should not map the experience only with the interaction of the clinical frontline staff. There are backroom systems and processes and protocols that also have to be designed and managed in a careful approach to optimize the experience. On slide 13, you have a different journey for diabetes. When you download these slides, you'll be able to use these as a catalyst for conversations with your care teams and make sure that the design teams are interdisciplinary and interdepartmental to get the greatest value. Another resource for folks participating in this webinar is apparent on slide 14. There is a hyperlink to this website, a firm that is involved in mapping customer experiences for a wide variety of industries. It's beneficial for those of us in healthcare to recognize and look at our challenges through a new lens of the value of mapping every stage of the experience, the knowledge that they need, the anxieties they have, and the quality of our working relationship through that journey. So how are we going to use this recognition that we have multiple types of clients, patients, consumers, customers? How can we use a fresh attitude and new information? We're going to turn to our colleague Kurt to start shaping some of our conversations in this regard.
Thank you, Jim. Yeah, I think if you think back to the customer journey maps that Jim was sharing, and take the comments that not only do we have to map the health system, the frontline staff, and the back room, but we also have to understand the consumer and the way they live their lives outside of the healthcare system. Fundamentally, we believe that the consumer should be the hub of this process. The consumers are on the journey, the patients. We need to upend the system and focus on that consumer, not purely on the encounter, the claim, and the physician. So why do we say that? Well, the patient should be the hub, but it's not that way today. Our electronic medical records and the systems that are created around them are designed around the claim, not around the customer. And this needlessly complicates our quest for consumer engagement. We need to get out of those electronic medical record constraints and think about how the consumer relates and how we relate to the consumer across the preventative, the primary care, the condition management, physical therapy, nutrition, fitness, and screenings, in this case, that make up the universe that this consumer is interested in. If we understand those individual consumer behaviors, we will understand how they relate to the health of that individual and what the drivers are that motivate the individual to seek assistance and treatment on their journey to better health. So how do we earn their loyalty and enthusiasm? Targeting, yes, but then what? We need to meet them where they're at, outside the four walls of the health system, to meet their health and wellness needs, not simply selling them a diet of more health care. So the key here to develop that comprehensive understanding is to realize that we in the health industry, in the healthcare industry, we're flying blind. 99.9% of the consumer's life, the hours in the day that they spend over the course of the year, are lived outside of our health system. So you, as a health system, as leadership and board members, are at risk without understanding that, without that comprehensive understanding of a consumer, understanding how people behave, how to reach them, and what is relevant to your community, not a generic national model. If you don't have the answers to these questions, you are indeed flying blind, and that becomes a real risk to the organization. So the questions you need to answer: who are your customers? Who are you serving and not serving? What motivates the individuals in your service area? How do you engage them as people and influence their health behaviors to really meet the needs that they have as individuals? The journeys and the journey mapping can help you understand the pathways that consumers are on and what points along those paths is appropriate for you as the health system to engage with them. So the key is to reach and engage. How do we reach those consumers and how do we engage them in that dialogue? Even if they're not in your network today, we can find out a lot of information about them, the risks and the drivers of need across the community as a whole. This becomes relevant to the services you provide. So if we look in the market here, we can see that a specific individual, a specific household, maybe not your current customer. In the individual insurance markets, we can see that this woman is married, has 3 children, some information about her education and income levels. And using information like this, we can understand her motivation, her engagement within the health system, her motivation to improve her status from a health perspective. She has a low index from a chronic perspective, is most likely not developed a chronic illness today. But even though she has that high level of patient engagement, she has a weak bond with her primary care provider and probably infrequently comes in for checkups. So this is an opportunity to reach an individual, a consumer that is not normally reached from within your system. So how do we look at that and how do we roll that up and look across the population as a whole? So who are you serving? So the key here, as indicated by the persona that we looked at previously, is your market share may actually be masked by aggregate consumer data. You have to get down into the details to look. So if we look here where the red arrows are pointing, segments 4 and segment 7, segment 4, this healthy young family population, in the case of this health system we're looking at, they actually have a very small market share, less than 15%, less than 20% of this healthy family segment is actually a patient of their health system. They're spending a relatively small amount, they're relatively disloyal, compared to the ailing boomer population in the upper right, number 7, where they actually have almost a 3/4, almost a 75% market share. If you blend all this together, they're doing fairly well across the community as a whole, but within that specific population of healthy young families without chronic illnesses, they're not attracting them as patients. They're not delivering services that are relevant to them in the market. So as a board member, you need to take the long-range view. Your investments span 10, 20, 30 years or more. How do you reach and engage that population of healthy young families today so that they remain your patients and your consumers well into the future? What are you not doing today that is missing their needs? and strategically, if you ignore them, what happens in the future? So let's take a look further on the next slide at what this population, how they behave and what they're interested in. So how do we reach these healthy young families? So we see here some indications of who they are and how they behave in your market. Lots of indications of having children in the household of all ages. And this tells us a picture from a demographic perspective of who they are and how they behave. But it's missing the clinical perspective. So on the next slide, we overlay this with their behavior as it relates to the healthcare system itself. And we can see that they are indeed in the bottom chart in orange under-indexed in the chronic illnesses of diabetes, hypertension, joint degeneration, etc. But they're over-indexed in things kids get, ADHD treatments, acne, asthma, developmental disorders, pneumonia. So as you look across the types of services that are relevant to this population, when you reach out to someone who comes out of this consumer segment, you don't need to be pushing your effectiveness at treating diabetes or heart disease. You need to be talking to them about their children. How do you reach these families? Through their children. And then through the children, we can get to the rest of that family unit. But understanding who they are from a demographic perspective and who they are from a clinical perspective is crucial in crafting a value proposition that will bring this population into your health system and allow you to treat them for life.
Kurt, you're raising some very good points. You've stimulated a question I just would like to introduce here to look at. You talk about reaching out to these target populations and building a new relationship with them. How should we go about educating our own employees in the health system to be ready, willing, and able to have those conversations when they're not maybe used to doing that? And later we'll talk about the challenge of getting the board more comfortable thinking about and having those kinds of conversations. Are you seeing some practical things that would be useful in that regard?
We are, and in fact, the next slide, this is a great segue into the next slide where we talk about, raise the question, do we share information broadly enough? And that includes, as you're pointing out, your own staff, your frontline staff, the people who are taking appointments on the phone, anyone who is communicating with a consumer. If you can share information with them so that they understand what type of consumer they're talking to or interacting with when that person is in front of them, it helps them be more empathetic and to relate to that consumer in a way that is relevant and meaningful, right? So instead of thinking about purely the transaction when I'm on the phone taking an appointment, I need to be understanding who is the person that is on the other end of that phone call. Is it a single working mother who has limited time during normal business hours, and I shouldn't be trying to push her into a 10 o'clock meeting where she has to get 10 kids out of school and take time off of work, and I should be thinking about how can I slot this person into early morning, evening, maybe weekend hours, and provide her the services on a level that's important for her.
You're making a very good point, and unfortunately we see at the board level and the C-suite, we underinvest in those frontline people, those people that can make or break the experience and that journey are underinformed. We don't let them see our strategic plan. We don't engage with them to share what we're trying to do. So I like that idea very much about sharing the knowledge more broadly, because we're all in this challenge of designing and guiding these experience relationships.
And I think to continue down that path of developing empathy for the consumer across the organization, a story that came out of some work that we did interviewing prospective patients for a new clinic, as well as the physicians and frontline staff who staffed it, there was an interesting juxtaposition of two comments that came out of one from a physician and one from a consumer. The consumer said, you know, I expect this clinic, much like a retailer, to be open when I need it. I am able to go to Office Max and Costco and other other institutions where I consume things, I'm able to buy from them when it's convenient for me, and that's what I want out of the clinic. And juxtaposed directly opposite that was a physician who said, you know, I went to school and I got a higher education degree and I went into medicine because I didn't want to be in retail and I don't want to have to work long hours and I don't want to have to work evenings and weekends. And I think that level of disconnect between who we're serving and how we want to be served as employees is really challenging. And actually presented with those two pieces of information, the chief medical officer from this institution posed the question to his staff, which was, is our hospital designed to serve the customer or to serve us as physicians? And there was a long period of silence after that question was raised because we realized that the hours, the convenient parking for physicians, the time schedules, it was all designed to get the surgeons in and out of the hospital quickly, and the patients were the ones who were made to wait. That sort of thinking needs to be changed, and I think sharing this information more broadly can get us there.
Times are changing, and it's that kind of mindset and series of questions that we hope our boards will be embracing and understanding and applying in the future. Thank you.
So on this slide here, to just finish up the information sharing, not only do we have to share with our own staff, but we also have to share this information more broadly, the board, the community at large. We need to put all of the information about who we're serving and our successes into the hands of our customers proactively. Let them hold your feet to the fire. Let them keep you accountable to continual improvement, and ask yourselves as board members and leadership teams, do we share enough around our metrics and tracking performance and the goals that we're trying to meet to demonstrate change in engagement across the health conversation?
Thank you very much. As we turn to slide 22, right at the top, we're reminded about the focus of this webinar. We're trying to plant some seeds to transform the customer experience. Very difficult to transform an experience if you can't understand what it is, that you've not mapped the journey and all the different encounters that we have with the patient and the patient's family. We recently did a project with a multi-specialty clinic, and we identified 25 key moments of truth where there's an opportunity to make or break the experience and the relationship. And it starts before they make a phone call. It moves through the phone call where they're trying to find out what services are available and how to make appointments. And of course, the interaction in the care venue itself are important, but many of our caregivers, our managers, and our board members don't take a long enough view on the whole experience, pre-interaction with us and post-interaction. And increasingly, we're going to be economically motivated to pay attention to that. You'll see in the second line on the top of page 22 that we are very much about the challenge and the need to create a culture that is not just focused to the customer, but as you just mentioned, Kurt, that is accountable. And we have to find new ways to hold our feet to the fire. I love that expression. And it's not so easy, and there's a very important role the board can play to make this happen. The first is to have conversations at least once a year about what are we doing with our care teams to map experiences for unique types of customers. What are we doing to customize those experiences? Asking questions directly to the consumers about their experience, not just the quality and the satisfaction, but are we linking with them enough? Are we following up with them enough? How do we map and monitor the trends of these satisfaction and consumer interactions over time? So as we get ready to go into a Q&A session about this arena of accountability to customers, I would encourage us to keep in mind and the board to really be a champion for breathing life into this rather quiet document that exists in every one of the hospitals in the United States, a Statement of Patient Bill of Rights. Well, what does that really mean? I would be very surprised if any time in the last 3 years the board had 30 minutes of one of their board meetings to talk about what is our patient's Bill of Rights, how well are we doing to assess whether the patients really understand that, and are we walking the talk of the key words that are captured in the patient's Bill of Rights. So that's one of 5 areas that we would encourage board members and senior executives to have conversations about. The second that you see on slide 23 is this very important question of asking the patients themselves, how can we improve your experience? Not just whether the surgery worked, but the entire experience of interacting with us over an extended period of time. And then we've got to be prepared to respond to the answers we get to continuously improve. The third point is very important as well. Boards need to be enabling their executive teams and physician colleagues to report the performance scores. Some of them are going to be embarrassing. Some may, in fact, even get us into legal hot water, but it's only through that kind of transparency where we report what we're doing and the results inside and outside our organization that we as an industry and a community and an institution and a group of caregivers can mature ourselves in the journey to better health and better health care. The fourth very important element for boards to take into consideration is that they influence the flow of money, investing in team development and education about service excellence, about the mindsets and attitudes that have to change. One of our clients is Regions Medical Center in St. Paul, Minnesota. They have a very strong program that is very much a part of the culture of that organization. It's referred to as best care, best experience. They have been doing this for a decade. There's a link on slide 23 to find descriptions of some of what they're doing. That kind of cultural investment is essential, and boards can be key advocates for that to occur. Finally, so many of our organizations are starting to do a better job of reporting, but we don't do a good enough job on celebration. Some of you have heard me mention in earlier webinars that here in Minnesota we have a large number of Catholics and Baptists. We're very good about guilt. We're not so good about celebration. And the more that we have boards and executives and physician leaders celebrate the progress that we're making to optimize these customer experiences, the better off we're going to be. And the more we can celebrate staff and physicians and volunteers that go above and beyond to make that experience positive. At the end of this webinar, then, we have an opportunity for many questions coming up. I want to remind us of these messages that we hope that you pulled from our interaction. The idea that the customer is not a 4-letter word. In fact, it needs to be central in all that we do in terms of planning, programming, and budgeting. We have to look at customizing the experience around unique types of patients and their family situations, to acknowledge the point that Kurt made that over 90% of their lifetime experiences are not when they're interacting with us, and what can we do to influence those other domains so that their experience and their outcome is optimized. The idea of using data in new ways to look at the purchasing behavior, the psychographic patterns, the needs and style of moving through life is important to understand how we guide the style and the movement through our care experiences. Data monitoring, a culture that celebrates investment in this information and using it for planning as well as evaluating results and forecasting trends by looking at the patterns of use are all important in our future. And finally, using information to report where we have need for improvement, but also very importantly to celebrate the good work that is happening every day in our institutions, but can always be better. So let's wrap this up with just 3 actions for board members to keep in mind. The first is to educate all of the players, frontline, physicians, board members, community leaders as well that may have an influence on this journey through a care map or a experience map. The second is to be prepared in everything we do to invest in using new information, new insights, new interactions, new conversations with our consumers to better understand them as individuals and their lack of understanding or lack of appreciation, or how best to take advantage of the resources that we work so hard to make available for them. Measuring the customer performance in different ways than just traditional satisfaction scores and HCAP scores will be important for our future vitality. And then finally, this refrain that I like to embrace, celebrating the results, celebrating teams and individuals, celebrating the patients that we invite into the care mapping process, celebrating the interactions in the community that can nurture and support their journey toward healthier lifestyles, as well as stronger and more effective ways to interact with the care experience for better health care, as well as better health gain. The results of all this, we think, is that the customer is going to be much more likely to engage with us for stronger relationship, greater rapport, and more reliable respect as we go forward. We hope these are provocative ideas. I see that we've got a number of questions. Kelly, we'll turn back to you to see if we can have a conversation to explore this further.
Wonderful. Well, Jim and Kurt, thank you so much for sharing these great insights and examples of what healthcare organizations can do to really set themselves apart in the eyes of the customer. I'd like to call attention to the additional resources we have linked to page 26 for your future reference. And all attendees will receive a PDF of the presentation via follow-up email, all live attendees, I should say, which will also contain a link to the recording so you can forward and share the insights with your colleagues. So we'd now like to open the discussion up to the audience. Please submit any questions in that question and answer panel on the right side of your screen, and we have received a couple already. And we've got another about 10 minutes to go through and dive right in. So the first question is for both Jim and Kurt, how do you engage other community leaders with this data to improve community health overall?
One thing that we're seeing both physician leaders and boards do is to develop a draft experience map. Hotels do this, banks do this, other industries anticipate the movement of their customers through their care experience. Draft one up for a routine delivery, and then go into a Rotary meeting or a community group or a community needs assessment team that's working, and pick 3 sample journeys for a healthy woman that's going to have a routine delivery, an older man that's got a cancer problem, those unique patient types that I talked about, and actually engage community people that aren't formal members of your healthcare team. They're not physicians, they're not nurses, they're average people, and ask them to react to that flow. Did we miss something? Ask them questions like, what would be barriers or obstacles for this experience to go well? And once they've identified the top 2 or 3 barriers, oftentimes they are misunderstanding of information or lack of understanding of how to use the care experience or the clinic or the hospital. Get them involved in a conversation on how we could remove, reduce, or work around those barriers so they can actually inform us and guide us to not only map the journey, but to improve the journey. And you can do that with faith-based groups, in church groups, in community groups where you have youth involving high school students or college students. We're all living in diverse communities, to go out to community groups that have high Hispanic groups or African American groups or Southeast Asia groups, and engage them in looking at the experience maps, identifying barriers, and helping us find ways to remove, reduce, or work around those barriers. Those are a couple of ideas, Kelly and Kurt, that I could think of. Maybe you have some others?
I would just add to that once you've gone through that process to understand the customer journey and the hassle points around that, start measuring it, right? Let's track all of your customers as they go through that process, both inside and outside your system, and count where people are falling out of that, which steps people are falling out of the process, measure it and target those areas for improvement, and then publish it. Publish those numbers on a monthly basis to those stakeholders and to your customers, and use that information to drive all of you to better performance.
But now you're making me nervous, Kurt, because now you're holding us to be accountable for what we say we want to do. And that's one of the challenges, is to provide that kind of transparent, honest, and open and accurate data about what is happening to the patients and consumers.
I have a great follow-up question then related to exactly what you're talking about, which is how to communicate not only the strategy but the data to the key stakeholders, everyone from volunteers to physicians and everyone who would have a touch point or a hand in the process that would have a touch point with the patient.
One thing that I have seen very helpful is to not communicate the data in Excel spreadsheets. They have to be communicated in infographics. They have to be communicated in with pictures of real people. They have to be charts and graphs, and they have to have anecdotes associated with them to bring the numbers to life. Otherwise, the eyes of our staff, our physicians, our board, and our patients and customer and community leaders will glaze over. So if we really are serious about them understanding this, we have to put that information out in digestible formats.
Jim, and I think we have seen some great successes with community organizations starting key meetings, whether it be at the board level, whether it be volunteer orientations, any key administrative meeting with a patient or customer experience story, something that can be inspirational, that aligns with the strategy, and yet shares some of that individual experience, which is really data, that's what we're talking about, with the group at hand. Another question coming in, you talk about the evolution of the customer demand. Is this being taught in physician or leadership education? How do we, how do our leaders learn about this? How do physicians learn about this? And what is our role?
I think it's not being taught today, and I think that's part of the challenge. We have a history of resistance to thinking about the customer as the customer. We tend to, in fact, I had a conversation with a physician several years ago who flat out rejected the notion of customer. He said, they aren't customers, they're patients. They do what I tell them to do. Now, as Jim pointed out earlier, right, when we talked about grudge purchasing, right, healthcare is, if you graph industries and consumer interest on a chart listing both frequency of interaction and level of interest, hospitals and health insurance are in the bottom left-hand corner. They're the lowest, right? We don't want to interact with them very frequently, and we're not very interested unless we have an issue. But in the upper right-hand quadrant, the things that are of most interest and most frequently used are fitness, parenting, and health. That's health. We're serving health care because we're thinking about them as patients. Up in the upper right, where the retailers are playing and the health and wellness companies are playing and the people providing parenting resources, that's health, and that's what consumers want. And so the real trick for us will be to turn that system upside down and begin thinking about the customer as the customer, not as the patient.
Well, and you make a great point, because back to our earlier conversation about medical decision makers, it's often the healthy young families that are making those decisions, the parents in those families that are making those decisions for their families, and those will become your dedicated and loyal patients for the remainder of their life. They will be your biggest advocates, and they will be the ones touting your praises in the community. That's the best marketing you can get.
That's right.
I'll just share one closing observation, Kelly and Kurt, and that is for board members, this is scary information. Still, the majority of our money comes from dealing with older, chronically ill patients. And as we look at much of our behavior driven by the economics of our industry, it's very important to realize that we have to prepare for the future, use these experiences to map and to manage the relationships strongly with the older chronic disease patients, because they also have needs. But we have to be mindful and think long-term about all of these segments and the diverse challenges we're going to face for our own economic vitality, and also to walk the talk of our mission of dealing with the health and well-being of the community, not just when they present themselves to us.
Absolutely. Well, thank you again, both Jim and Kurt, for your time today, and thanks to everyone who attended and asked these great questions. I think we had some great dialogue. If there's anything else that you'd like to discuss with any of us as you review today's content, please don't hesitate to reach out. Our email addresses are listed at the bottom of your screen, and we really look forward to hearing from you.